Hello, Dr. Şener Aktürk. Thank you very much for agreeing to take part in our interview for the TRT World Research Centre.
Thank you for inviting me.
In your recent essay in our ebook, which is published by the TRT World Research Centre, you've touched on a number of aspects of the impact of COVID-19 on policies, on culture. Among them is, as we've noticed, is how a lot of the countries hardest hit by COVID-19 were democracies. And you've addressed a question that's out there. Will democracy save us from this crisis, or do authoritarian regimes and dictatorships do better in dealing with this crisis? And perhaps another segment of it is, will democracies become less democratic as they address this crisis because they might need to implement certain policies that they're not used to? I don't know, what's your view?
Mm-hmm. The coronavirus pandemic actually challenged the assumptions about regime type and disaster preparedness, because one of the most established kind of claims, or at least hypotheses in this scholarship literature, is that democracies are much better in fighting natural man-made disasters such as famine. However, in the current coronavirus pandemic, we see that a binary kind of dichotomous distinction of democracy and authoritarianism does not fit the success-failure pattern that well. Because on the one hand, we have some of the oldest, in fact, the oldest, most consolidated democracies, namely the United Kingdom, the United States, and also France, if we were to count a third old consolidated democracy, being among the hardest hit, both in absolute terms, but even in terms of relative terms, they are not doing that well. But on the other hand, there are also very hard-hit authoritarian regimes. Iran comes to mind, and early on, of course, People's Republic of China, although its numbers are questioned, it could have been even hit worse. But on the other hand, when we look at cases of success too, there are some democratic polities. South Korea is justifiably hailed as a case of extraordinary success, with only a few hundred fatalities in a nation of more than 50 million people, and a major international hub, urban, advanced industrialized society. But also in East Asia, this time Southeast Asia, Vietnam, a communist authoritarian polity, which is at least as successful, if not even more successful than South Korea, because it only had about several hundred infections and no fatalities in a nation of about 95 million people. So if we think of these cases, democratic South Korea, authoritarian Vietnam being at the most successful end of the spectrum, and democratic UK, US, France, but also authoritarian, almost totalitarian Iran, to a certain extent China, being on the negative end of the spectrum as cases of failure, then we realize that a very simplistic framework of democracy versus authoritarianism doesn't fit, doesn't explain patterns of success or failure. So it's not really, it doesn't seem, at least, of course, the pandemic is still unfolding, although we need to note that it has been almost 3 months in most of the critically hit countries. So we now see a much better pattern than we used to in March, April, or early May. By now, we do see, very hard-hit democratic countries. Again, Belgium being an extreme example of a very hard-hit country, and also a very hard-hit kind of authoritarian policy. So what we can say, at least preliminarily, is that it does not seem to, the pattern of fatalities and infection does not seem to be correlated positively or negatively with regime type so far.
So it's either it doesn't have an impact, or maybe it's just too early to tell.
Yes, it could be too early to tell, or it is mediated by other factors that I tried to highlight in my report. There are, political regime type is only one of many factors that go into disaster preparedness and disaster response. So it may have an effect. I mean, theoretically, we would expect free media, scrutiny, etc., to have an impact in triggering, motivating central governments to respond at the very least. But it may be mediated by a number of other factors that might hamper action.
Moving on to some of those factors, since we're not sure about the impact of the system of government, you've also touched on cultural and religious norms. And there's a lot of discussion. People sometimes suggest that these norms have a negative impact on the spread of the virus, or it makes it spread even more. Other people say no, the idea of being clean, that helps combat the virus. What are your views on those?
There were three kind of culturalist arguments that were quite prominent since very early on in the pandemic. One of them is, again, a resurgence of East Asian norms, Confucian norms argument, given the success of South Korea, but also Vietnam. So across the political divide, many East Asian societies performed really well. Another argument about Islamic norms, especially hygiene practices, and finally, moving further to Northwest Scandinavian lifestyle. And I touched on all three of them. And what I emphasize here is that not some sort of essential, kind of ambiguous, abstract, vague, norm about Scandinavian, Islamic, or Confucian lifestyle, but what could be the specific mechanism or practice that in helping to stop the spread of the pandemic. And when we turn to the Confucian East Asian norms debate, it seems like what is emphasized there, which might have a causal impact, is following the instructions from the central government, some sort of discipline in society, right? This kind of hierarchical obedience to political authority, whether democratic or authoritarian, doesn't matter, is usually highlighted as a cultural feature. And indeed, one can see why that would matter enormously when central government in Korea, in Vietnam or elsewhere is issuing warnings and measures that individuals have to implement. It's important that individuals then implement it. So to the extent that this is still operative in Confucian societies, yes, it would have. When we turn to the Islamic norms or practices debate, there what was highlighted and it's kind of showed, at least in some of the statistics that were quoted, is water-based hygiene, the prevalence of, for example, washing hands, which is really high because of religious norms, right? I mean, Islam necessitates using water, and quite frequently on a daily basis for the cleansing of the face and the hand and so on and so forth, to the extent that that is operational, right? Because there's the assumption that these societies still kind of follow these hygiene procedures kind of assiduously, to the extent that it does, yes, then it would have a preventive impact. And when we turn to the Scandinavian norms claim, there it was what I quoted. In that case, I think it was from Swedish journalists. They argued that the Scandinavian lifestyle, based on minimal physical contact, no hugging, kind of dispersed residential pattern. It's a low density, Sweden is a very large country with a very low population density. So this kind of physical distancing is already ingrained, they claimed, in the Swedish and broader Scandinavian lifestyle. So yes, avoiding kissing, this is already second nature. Yes, and indeed, to the extent that this is part of, let's say, a Scandinavian culture, of course it would help prevent the spreading of the virus. But again, I'd like to highlight that within these cultural, religious, geographical subgroups, again, we have huge variation. Right? I mean, Sweden is harder hit than Denmark by a big margin. Iran is one of the worst hit countries. It's a Muslim country, but Turkey isn't, and a few of its neighbors did much better. And likewise, even in East Asia, in the so-called Confucian zone, we have countries that aren't doing as well as, let's say, South Korea or Vietnam. So, as in the case of democracy authoritarianism argument, the cultural or religious lifestyle factors argument only goes so far.
Right.
Yes.
Well, can we find something that we agree on? For example, the need to invest more in the health sector. A number of countries were caught off guard. Even even democracies were ranked quite poorly because of their unpreparedness to adapt to the way they would deal with coronavirus. Do you think moving forward, people would invest more in healthcare and preventative measures?
Yes, I mean, one would think this would be a very logical consequence of a pandemic, is that it would trigger investment or even over-investment in the healthcare sector, or the provision of free and universal healthcare. But still, I'm suspicious that this is what's going to happen, because each society has its own specific political system, and one can even, in a pessimistic scenario, in fact, might foresee a further augmentation of inequalities as they are reflected in healthcare measures. For example, I mean, again, in societies that have very high levels of inequality, again, you can think of southern cone of Africa or South America. You can think of Brazil, South Africa, to a certain extent United States, though of course not as much as Brazil or South Africa. These socioeconomic and other centuries-old inequalities might be even more augmented, and so you might have just like you have private armies in some of these societies, you might have an extreme privatization or kind of siphoning off of scarce health resources for the protection of the privileged. That would be a pessimistic scenario. As I alluded to in the report, I'm expecting the opposite, in the sense that such a pandemic should create, under normal circumstances, a wave, a global wave, a demonstration effect, you can think, in favor of more effective and public social healthcare in countries that do not yet have this, because much of continental Europe, from Greece to Turkey, from France to, former communist states of Eastern Europe, already has free, universal public healthcare. But, again, United States being a leading example among OECD countries, among advanced industrialized countries, there are still quite a few polities without universal free healthcare option. And the real question would be what kind of political impact it's going to have in their debate. So far, I mean, to the extent that I can follow, it did not make, the pandemic did not make healthcare the central political issue in any of these societies yet. And we are in a presidential election cycle in the United States. One would think this is an obvious thing. That would be number one. And it's still somewhat early, although for the US election cycles, it's not that early. The elections in November. And then, you have, of course, UK and France, both which did quite bad by comparative standards. Will healthcare and its provision become the number one or number two, one of the top 2-3 issues in their domestic politics in the coming years? We'll see. Again, this is a kind of an experiment, both a global experiment, a comparative experiment, how different societies kind of respond to it. And another important issue that I kind of, again, hinted but did not emphasize as much is really the care of the elderly, because the nursing homes are the hardest hit in the United Kingdom, in the States. And we do really see a huge variation in terms of public and political attitudes vis-a-vis this catastrophe. Right? There are societies, again, from East Asia to the Islamic to the Western Europe, you can have a spectrum there, variation in how, what is the prioritization and kind of attitude vis-a-vis the protection of the elderly and their priorities. I said in the political discussions, we'll see a lot more of this, I think, in the next months and perhaps years.
Like you said, we'll just have to wait and see. But for now, Dr. Akturk, thank you so much for your time and for taking part.
You are very welcome. Thank you.